fiery. Today we will be hearing the evidence of Dr. Ndumba Kalanda. I see, Mr. Kalanda, you are by yourself. All right. Do you have an objection to taking the oath? You don't. All right. So I will administer your oath then before your evidence. So will you say after me, I and your names?
No.
Swear that the evidence that I shall give
Swear that the evidence that I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
If so, please raise your right hand and say, so help me God.
So help me God.
Thank you. So, Dr. Kalanda, I don't know if you've been watching these proceedings, but we received your representations. We've also received the response from the scheme. So you can take it. We are fairly familiar with your version and the scheme's version. So we would like you to just take us through your complaint as you see it and what aspects you want to emphasize. That will be entirely up to you. But maybe you can start by introducing yourself and your practice and what you do and what your client base, your patient base looks like and what the relationship with the scheme is.
First, I greet all of you. I thank you for the opportunity that is given to me. I am Dr. Ngcukaitobi Kalanda. I am a radiologist, specialist radiologist, working in private practice in Polokwane, Limpopo. I'm the owner of my practice. This is the first black-owned radiology practice in the province. My work consists of...
The first or the only?
The first, and the other one came, I think, 2-3 years after me.
I see.
Yeah, so we are two now. That my work consists of, I work on a referral base. All my patients are referred by other physician when they want some radiological investigation, such as a CT scan, ultrasound, X-rays, etc. Patient should come with a request form, and in the request form, it is the physician states the reason, his clinical findings, and what investigation specially he wants me to perform on his patient. We take the patient through the process and we send him to my team of radiographer to take the pictures, and myself also. We perform all the investigation together. After collecting all the data, I sit and read the images and read the findings and produce a report for the referring physician, which will be handed over to the patient or to the referring physician. When this process is completed, patient usually they come with a medical aid. Then we first confirm the benefit with the medical aid, and then we introduce our claim with the medical aid in connection with examination that was done. And from there, we expect our payment, and the patient goes to his referring physician. When they have some query, they contact me, we talk, and we discuss about the case. So this is the situation.
Dr. Kalanda, just to interrupt for a second, by way of introduction, you've got a bundle in front of you, is that right?
Yes, I have two bundles.
Is it one of our bundles that are
Your
paginated?
bundle is here.
Great. Would you mind turning to page 765?
Yes.
Is that the license radiological equipment in your practice?
Yes, this is the license for my radiological equipment.
Just by way of introduction, could you explain then what equipment you have in your practice with reference to the license, so we know what procedures, I suppose, or not procedures, what radiological tasks you perform?
I have a scan machine. I have X-ray for general X-ray, and I do a fluoroscopy. I do ultrasound. I do mammography. Yes, those are the main.
So do those 4 machines listed in that license correspond with
Yes.
those 4 tasks? Okay, thank you.
Can I continue?
Yes, please.
Okay. So, there is a document that I emailed this morning on my complaint. I introduced a complaint against MedScheme and Bonitas. And I think that the way they're treating me is probably due to racial profiling. That is why I introduced my complaint. On
Dr. Ngcukaitobi, can I ask you to address your complaint in relation to both of them separately? And I also see in the bundle that there's correspondence from Polmed. Do you have issues with
Yes.
Polmed?
MedScheme covers Polmed. Polmed comes under MedScheme. And Bonitas also, they are on MedScheme. Yeah. So I think it's MedScheme, what I think is the one who's managing those medical schemes. So it started in August 25 August 2016. I think the document is not with you, but I'll just email it now. I receive demand of verification of services from MedScheme. It was sent by the MedScheme Forensic Fraud, Waste, and Abuse Management analyst. They were asking me to provide them with my radiation certificate. It was in 2016, to provide them with radiography reports, and to provide them with letters from referral doctors with clinical information. Why they were asking it? Because they say that they have identified some irregularities. This was in 2016. Then I took my phone, I called the person who sent me the email, and I asked her, why are you asking me all this, and what irregularity have you found? Are you doing it because I'm not a white person? She said, no, look, doctor, I just advise you to send us the document that are requested, and then you take this thing out of your way. I followed her advice, then I sent her the document in 2016. Then after sending her the document, I didn't hear from them. And I thought that it was closed and they didn't find any irregularities. Now, in May 2018, I think 2 years later, 8 May 2018, I received a...
Sorry, Dr. Ngcukaitobi, I mean, I don't have the 2016 documents here.
Yeah, I can give it
So
to you.
I don't know if you gave them to
I
as
just
part of your
emailed
complaints.
it, but I can give it to you. Because yeah, I've emailed this to you just not long ago. So now, in May 8 May 2018, I received an invite letter from Forensic Services, and they were inviting me to because they have been mandated by Bonitas when they were pursuing preliminary investigation. They have uncovered certain discrepancy in account which I have submitted to their clients. So before making a recommendation to their clients, they were proposing a meeting so that I can go to their office with or without a legal representative.
Dr. Kalanda, would you mind just telling us which page in the bundle this 8th of May
On the
2018
bundle.
letter
Okay.
is? Where?
Because you see the bundle, yeah. Page 743. Which, is it the same letter? No, this one is another one.
That is the letter from the forensic
No, this
investigators
one is-
representing.
Yeah. Because you see, I just received your bundle now, so I have my own bundle, so it doesn't follow the same chronology. Let me try to see if I can find it. Okay. Page
document-
757.
757.
Yes, yes, of course.
Thank you.
Yes, sir. So, after receiving this document, I sent a reply to the investigator asking him which which specific case he was referring to. So
Dr.
that
Kalanda, sorry, now that I'm looking at the letter, it's on a Bonitas letterhead.
Bonitas letterhead, yeah.
And it
This
says-
one is a Bonitas, but there is it comes with an email, an invite letter from, let me check it, it's here.
And further, it is signed by Davi Supra, who is a director, and
Yeah.
it says Ngcukaitobi Forensic Services duly mandated by Bonitas Medical Scheme.
Yeah. Because it was an invite letter. Can I continue?
I'm just trying to understand who the letter is from. Is it from Bonitas, Ngcukaitobi Forensic Services, or MedScheme?
I received an invite letter from Ngcukaitobi Forensic Services. And this letter from Bonitas was in an attachment. So, the letter from Ngcukaitobi said, please find attached letter on behalf of our client, Bonitas Medical Aid, for your urgent attention. Kindly contact Chris, they give the number, within 40 days from date of receipt hereof to arrange a suitable date for the requested meeting. So, this is the cover. And then the attachment was the Bonita letter. On my reply, I said, good day, I have received your email and I thank you. Would you please and kindly identify for me which account you are referring to?
Dr. Kalanda, apologies for doing this,
No,
but
no.
where in the bundle is your email reply?
In the bundle. Sorry, can you please give this so that she can, then I will follow. This is the, I don't have access to it. This is the letter, and this is the attachment, and where is the reply? Yeah, this is the reply. Oh, no, I don't. This is my reply. Huh? So this is the initial, and this is my reply. Then you give it to me. I will continue.
All right. You know what, Dr. Kalanda?
Because
Let's-
this
let's do-
bundle,
No,
I'm
no, no,
not
wait.
I have my own bundle
wait,
which I
wait.
came
Let
with,
me
yeah.
finish. What we must do, we must adjourn and take 15 minutes. There is a problem because your documentation is inconsistent with what the Secretariat has given to us. And so we are struggling to follow the sequence of your evidence. So we are going to give you 10 minutes to speak to the members of the Secretariat to make sure that when you are referring us to a document, it can be traced to the documents we have in front of us.
Okay.
And do you have anything to say?
No, I will try to see those documents and put them according to the same chronology which with my documents, so that I can follow.
No, I agree. I mean, I want to give you 10 minutes to do
Yeah,
that. Are you happy
I'll
with
try,
that?
yeah.
All right. Thank you. We are adjourned for 10 minutes.